Hello, it's common knowledge in Uganda that alcohol and drug use has shot among young people between ages of 16 to 35. However, did you also know that mental unwellness is a high-risk factor for contracting HIV? My name is Renata Twini, a journalist with Solutions Now Africa. Today, I want us to relate mental health and HIV among young people. As you may be aware, HIV is a significant health concern in Uganda. Approximately 1.4 million people are living with the virus. The country records about 1,100 new infections every week. About 40% of these new infections are young people aged 15 to 24. The country has also seen a spike in depressive disorders, such as alcohol and drug use among young Ugandans of the same age group. Can we really say that mental unwellness is part of this challenge?
There is a bi-directional relationship. In other words, HIV can lead to mental illness. And again, the other way around, mental illness can predispose one to HIV, you know? Because this person may not be able to say no. If he's approached maybe for sexual endeavors, they are vulnerable to an extent that they can be manipulated into sexual practices, hence ending up getting HIV.
Beyond the physical consequences, HIV care and management come with a mental toll on patients. In fact, UNAIDS and World Health Organization have suggested the integration of mental health services with HIV care. This is because 30% of patients experience mental unwellness, including depressive disorders attributed to unwelcome to social culture, call it stigma.
I found a big challenge 5 years ago when I opened up about my status, and I told the public I was born with HIV. I feel like I got the virus through sleeping around. So I found that HIV is in many cases related to sexual immorality, which is not the case. There's so many people who get HIV not through sexual intercourse.
Stigma leads to a feeling of shame, guilt, and depression.
For those who are disclosing, they are being shunned away, which now gets us to mental health issues. How do we support a young person who has disclosed to actually, stand their ground, to be firm, but also to kind of know that, it's a good thing to disclose.
World Health Organization further says that individuals living with both HIV and mental health conditions are more likely to have low retention in HIV care.
And depression is very important to be managed, because without managing it, patients with HIV are unlikely to adhere to their medication. Because someone who is feeling sad, weak, worthless, no sleep, no motivation, having no purpose to life, will not take the medication. And not taking the medication will ultimately affect the viral load.
It is evident that there is a crucial need for increased resources to address the mental health needs for people living with HIV.